We're going to talk with Amy West. And again, for those of you who are regular members of the digital health community in New York City metro area in the US, everyone knows Amy. She is extraordinary. She has been a leader in life sciences for decades. She's been a leader at Novo Nordisk in digital for over a decade. We've been working with her for so long, and she is so generous with her time. She's a mentor. She's helping out startups. She's helping out institutions understand how to work in digital. And she's also leading up the digital transformation of Novo Nordisk. Everyone knows Novo Nordisk now as one of the leaders in weight loss and diabetes, and just an extraordinary company. If you ever get to Copenhagen, highly recommend you visit their headquarters. An amazing group of people, an amazing institution in Denmark. And so, Amy, welcome to the program. Great to see you.
Thank you. Good to see you too.
And just start off with telling everyone who hasn't heard about you before, which is probably only one or two people in the whole audience around the world here, what you do and how you do it.
Well, thank you. Thanks for that little overview that you provided. That helps set the stage a bit. But I've been in the pharma industry for over 20 years. The last 15, I have been at Novo Nordisk, primarily in the commercial space. But I would say the last 4 or 5 years, I've moved into this sort of longer term strategy and innovation space where digital transformation is a huge part of that, digital health, but also sort of non-technical or non-digital innovation as well. And I basically oversee an internal incubator. I head up our U.S. digital transformation and innovation team, and we have a lab model called the APIS Lab, where we are focused on exploring, testing, and identifying these transformational innovative type opportunities in healthcare, all based on the customer's unmet need. That's our starting point. So that exploration could include disruptive technologies, digital data, but again, it could also be a low-tech, high-touch intervention based on whatever the appropriate solution is, based on the need of the customer.
That's amazing. And you've been a part of, again, the leading diabetes company in America over so many years now. You've been a part of so many firsts. Can you tell us a little bit about the key initiatives and pilots that you've been a part of, that have really optimized the patient experience and their outcomes, and how those sorts of innovations have contributed to Novo's leadership in digital transformation over the last few years?
Sure. There are a lot of examples, but one I like to talk about, I think it's a good example, but also one of the best experiences I've personally had and been involved in leading at the organization, started really over 12 years ago when I was in the commercial patient support space, where I worked with a team to build a personalized patient support platform for people with diabetes. It was originally called Cornerstones for Care, and this platform actually is still in existence. They evolved the name about a year ago, but it was under the Cornerstones for Care brand for over 10 years. And it was started out primarily focused on education for those who were seeking information about diabetes and that disease state. And so 12 years ago, that's in the really early days of utilizing data, but doing it, we were looking at it to do more than just sort of general targeting or generic product messaging. We wanted to structure a platform that would be much more personalized to the individual. And so we structured a way to collect information that would go beyond just the standard name, street, and email address. We wanted to really understand you as an individual as best we could in light of the parameters that we have around data privacy and things like that. So we were asking questions around, when were you diagnosed? How long have you been treating with medication? But most importantly, what are your personal health goals? And from there, you started to get a more holistic understanding of the individual beyond just the disease state. And so from that point on, we would capture this information and start to create a more tailored experience for you when you would come to engage in this platform. So the interface would be tailored to you based on the information that we knew about you. My experience would be different from somebody else's. The messages and the information that would come up would be different for me versus somebody else based on what we had indicated were important to us and were priorities. And so we had it was a very successful program. It was in the industry, it received a lot of awards for its sort of groundbreaking ability to get more personal. But to me, what's been even more interesting is that we were actually able to start to use the platform as a proving ground for other test and learn opportunities that supported our move into more digital innovation areas. Things like gamification programs, self-guided coaching, live coaching. We also created a virtual concierge that's powered by AI and machine learning. And all of these pilots that we tested were able to help us, again, continue to capture more information about the user that we wouldn't have had otherwise. And we also found that some of these things that we were testing didn't necessarily pan out, but it enabled us to test and learn in a very efficient way. A number of the things that we tried have been scaled and are continuing to this day to support our customers and support the business. But what underlies all of it is that the starting point for the genesis of all of this is always about listening to our customers, optimizing based on what we know about them, what they're telling us, and building the solutions based on their pain points and not the other way around. The digital interventions need to be based on their need. We don't want to just go out and test, we don't want to do things just because it's a cool technology or it's a cool new thing. We want to make sure that we're testing things that are going to deliver value for our customers first, and then pull that shared value through to the business. And that's been a good working model for us. And it's something that I pull through in our lab work as well. It was a kind of a long-winded answer, but it's really been an impressive program.
You know what, Amy, I that was an amazing answer. And as someone who worked with you when that this whole thing was being set up, 5, 8 years ago, whatever it was now, I can tell you this is truly extraordinary. The learnings that you've just shared with people, I really hope they're taking notes, because it is literally out of a textbook, and the textbook hasn't been written yet. So you and I need to talk afterwards about writing a textbook together, because you've really put it together.
I'd love to.
Everything that you've done has really evolved several different disciplines of UX, UI, persona mapping, user journey mapping, digital health, and again, patient centricity. There's so many different elements that you've fused together to ensure Novo's success, not only now with all the good work you're doing, but also in the future. So really well done. Congratulations on that. And again, thank you for joining today. Again, everyone, look for the textbook. Amy West is going to be writing with, hopefully she'll take my help on this, because I love it.
I'd love to. That'd
Amy,
be awesome.
no, thank you for joining, Amy. And we'll talk to you soon. Take care.
Take it easy. Bye-bye.